I only treated his foot and ankle. And in doing so, it released the tightness in his hip. So now we have 30 degrees of internal rotation with a normal end feel. It also released proximally. So without having him put the foam under the trochanter, we did not do that. And we did not have him lay sideways, sidelined on pillows. And I can take up the slack, and now I can spring the pelvis into left side glide. So very interesting how the proximal restrictions released. And now I will demonstrate the gain of foot mobility. And so now I grab the fifth metatarsal and it springs beautifully. And he was hyper with respect to anterior glide of the fibular head. And that is no longer hypermobile. That has normal stability. Okay, we tested other motions through the fibula and the fibular head, and those are normal. And now I can evert him slightly, and then I can overpressure, and there's movement in that direction. Okay, and now I can abduct the calcaneus, rotating the foot outward, and there's overpressure. And now I'm going to test internal rotation or adduction, and this is no longer hypermobile. I want to ask you how this feels in comparison to the right side.
Very similar.
Sorry?
Similar.
Similar. I agree. So that's how you increase stability, by increasing mobility in the direction in which it is restricted. Okay? Now let's have you sit up and let's see if that sacral torsion is still present. And bend forward and lean on your hands. I no longer perceive, see, I can spring it, and now that force goes through your body. So no longer presents with a sacral torsion. Okay? And lie on your back, please. So it was rib number 3 or 4 that did not spring on the left side of your body, and I'm below that. And you also mentioned a little discomfort in that rib. Mm-hmm. And we now have normal mobility. Any discomfort?
No. No
discomfort. Okay. And now I'm going underneath C1. So I find the mastoid, come beneath the mastoid, find the transverse processes of C1, then slide my finger posteriorly, okay? And I'm lifting on the right, and we get right rotation, okay? And I'm lifting on the right, that was left. I lifted up on the left. And now I'm springing on the right, and we have left rotation mobility at C1. So that also released in response to gaining mobility in the left foot and ankle, hip, and pelvis. Okay, so excellent case study. It's a very unusual case where that metatarsal gets stuck. Although I think that does happen sometimes if a skate or a ski boot is too tight. But thanks so much for letting us
thank you.
film this. Appreciate it. And then now I'll teach you how to self-treat.